On the Medical Watch, is it accidental or abuse? When it comes to bruises on kids, a local doctor hopes an app will help clinicians make the right call. Kids play hard
Usually it's nothing. That's the great news.
and can get a little banged up. In fact, it's common.
Whereas incidental trauma or accidental trauma, usually you just bruise like a bony area. You're falling, you have fun, you're like, get up, you're fine.
But sometimes it's not so clear, even for doctors.
The most common injury to be misdiagnosed as accident, when it's actually abuse, is actually bruising. And when those injuries were overlooked, those children were at much greater risk for a future fatality. This is a little 3D human that is in here.
It's not a diagnostic tool. Instead, Dr. Mary Clyde Pierce hopes the virtual child will help clinicians more accurately screen for potential abuse.
It's people that are in the front line having to make a decision in the moment.
Looking at more than 21,000 children across the country, 4 years old and younger, the Lurie Children's emergency medicine physician compiled years of evidence on bruising, then loaded the data on her injury assessment app called LCAST.
This was helped us differentiate abuse from accident in very young children with 96% sensitivity and 87% specificity, which is really remarkable.
The model calls out hot zones.
The red is like high risk, blue is low risk, and yellow is equivocal, where you have just as many abuse as you do accident.
And reminds care providers of lower risk areas like shin bruises.
In an older child, lower leg bruising, 7% of the time it was abuse and 93% of the time it was accident. Okay, makes sense. So the last thing you want to do is over-evaluate for abuse as well. And so how do we have a more accurate assessment? It's all about accuracy, right? So let's do the belly.
Users select one or multiple areas depending on the patient's specific needs.
Also, it has data that's embedded for each of these.
A few more clicks through questions, then the numbers help clinicians evaluate the odds.
And 84% of the time it was actually from abuse. 16% of the time it was from accident. So can you get abdominal bruising from accident? Yes, you can.
The app is designed to provide a deeper understanding of risk. In cases of jaw bruising, 97% of the time, it's abuse.
We also were looking at children that actually did have fatal abuse and looked back at what their bruises were, and that was certainly one of them when abuse was missed. So if I see that on a child, as opposed to maybe a back bruise or something like that along the spine, I'm going to feel much more anxious. I'm going to be much more worried. I'm going to be much, it's just going to really get my attention, I guess is a good way to put it.
Other areas that raise suspicion: any bruising on an infant. For children 4 months to 4 years old, bruising on the torso, ears, neck, and gums, the soft part of the cheeks, eyelids, and whites of the eyes.
If these seemingly simple things are happening early on, if we can do a better job of recognizing and differentiating between fun or incidental injury versus physical assault, then we can intervene much sooner and help the child, but also help the family.
And that means saving lives. Dr. Pierce is passionate about bringing published evidence right to the bedside. Her LCAST app is available for anyone to download.
Wow, that is really amazing to see it so, graphically put out there,
right,
to be able to make those visual connections.
And her dedication and all of the data that she put into it is really remarkable.